Good afternoon, ma'am.
Good afternoon.
Welcome to the Pasay Inventor. This is
Thank you.
Meenal. Today I'm with Pune's leading dermatologist, Dr. Rashmi Soni Lohiya. She has over 15 years of experience and the founder of Skinsa Clinic.
Thank you so much for that introduction.
So our very first question is, ma'am, while choosing there are many different names, one is dermatologist, cosmetologist, and triatologist. So how someone should choose one doctor particularly?
So that's a good question. So there is a lot of misconception regarding these terms. Okay, कि dermatologist, trichologist, cosmetologist. You see, alag boards.
Yeah.
People are saying. Even there is something called as an aesthetic physician.
Okay.
So this is all a marketing gimmick. Okay, so everything comes under dermatology.
Oh.
So dermatology is basically relating to skin and hair. Okay. So you don't require a separate trichologist for hair.
Okay.
So the curriculum of a dermatologist includes skin, hair, nails, all the cosmetic concerns, all the aesthetic concerns. Okay. So a dermatologist is enough for you to go for any of these issues. There is no degree like a cosmetologist or a trichologist. So these people are, people who've done some 3 months course, 2 months course, and they are calling themselves as the experts, which is actually they're not allowed to. So a dermatologist is the person that you go to.
So most of the people are not aware or might be that can dandruff affect the skin.
Okay. See, dandruff is basically flakes in the scalp. So that is the basic definition of dandruff for a layperson. Dandruff can occur because of a lot of things. Okay, so dandruff can happen because of an oily scalp. Dandruff can happen because of a dry scalp also. A lot of people feel that it happens only when you have a lot excess oil. Okay, primarily there is another thing. There is a fungus in the scalp. Okay, which causes dandruff. Okay, so this fungus is very common in people with oily scalp. ठीक है, अभी इसके वजह से डैंड्रफ होता है. फिर वो डैंड्रफ जब आपके स्किन पे गिरता है बहुत बार, सो यू गेट एक्ने. ओके, टिपिकली यू विल गेट अ लॉट ऑफ दीस पीपल गेट फोरहेड एक्ने बिकॉज डैंड्रफ जनरली फोरहेड पे गिरता है. ठीक है, so this is the oily dandruff. Then there is a dry dandruff because your scalp is dry. Okay, so they're two different things, and dandruff can occur in a lot of cases. Okay, dandruff is just a symptom. So dandruff आपको primarily will affect your skin and it can give you acne. There is another thing which happens with dandruff is that it can give you like you have flakes in the scalp, you can have flakes in the eyebrows also, in your eyelashes also. So that is a different condition again.
Okay.
Okay, so that also occurs because of fungus. So जिधर जिधर आपके बाल है या eyelashes है या sometimes it occurs also around the nose.
Oh.
Okay, so this is a condition called as seborrheic dermatitis. So that is a different thing. So that is also seen in a lot of people. Acne is the most commonest thing which is seen with dandruff. Now with acne also what happens is acne is primarily a hormonal condition.
Yeah.
Okay, so आपने ये भी देखा होगा कि generally around puberty जब hormonal changes होते हैं a lot of people get dandruff because again some hormonal changes happening, the scalp gets oily, right? So that can also be because of the hormonal changes, right? So primarily dandruff can exacerbate acne, but primarily it is acne is a completely different condition which is related to your hormones, your excessive oiliness of the skin, plus there is a secondary bacterial infection which happens, okay, which also causes acne, and plus your pores get clogged. So there are four things which lead to acne. Okay, typically you see acne in teenagers. Okay, but now acne is becoming more and more common. Huh? You will see now acne is coming even in adults. So it is a separate entity. एक्ने जो टीनेजर्स में आता है वो एक अलग चीज हुई. अभी एक अलग चीज भी है जिसको बोला जाता है adult acne, which is seen after 25. Now the hormonal changes have become more common. PCOD has become extremely common now. Okay, so adult acne is another manifestation of PCOD. Stress, again stress की वजह से भी acne आते हैं. आजकल there are night shift. In general, mental stress is so high, right?
Okay.
So all that is also another cause. There are other things also in some cases which can lead to acne. Primarily, certain medicines can cause acne. Sometimes certain products that you apply which may not suit you,
Right.
that can cause acne, right? So lots of reasons, but primarily some hormonal imbalance which happens. So you see acne in teens, you will see acne sometimes around pregnancy or delivery, and you see acne also when a woman attains menopause.
What are the different skin types and how someone can uh, choose their skin routine according to the skin type?
So see, typically for a layperson, I will tell you, so there is four types of skin. There is normal, there is combination, there is dry, there is oily. This, I think most people are aware of this.
Yeah.
Okay. From a dermatologist point of view, we have six types of skin. Okay. So it depends on the color of the skin. So a skin type 1, 2 is the Western population. They're extremely fair. Okay. Our Indian skin type comes in the 3, 4 category, 5 category. And then, so we have the 6, 5, and 6 is the extremely dark skin type. All right. Basically, how do you decide your skin type? Okay. So, firstly, whether to decide it is a normal, oily, dry. So I always tell my patients that when you get up in the morning, without washing your face, just touch your skin or dab a tissue on your skin. If you feel it gets oily, that means you have an oily skin type.
Okay.
If the tissue feels fine, okay, there is no oil, nothing, then you have a normal skin type. When you touch the tissue and it feels dry, you have that papery feeling kind of a thing, that means you have a dry skin type.
Okay.
And if you have, so at places, some people, they find that the nose and the forehead
The
may
T
be
zone areas.
oily and the rest of the skin may be normal or dry. So that comes in a combination skin type. Now, this skin type also changes according to the weather, right? According to your age, sometimes, according to the weather, according to the place where you stay. Mm. So, generally, like in teenagers, you might find more oilier skin. After menopause or in the old age, you find the skin is becoming more dry. Okay. Season wise, in the summer, you will find because it's high humidity and you might find that the skin is oilier. In the winter, because low temperatures, very low humidity, you might find that the skin has become dry,
Yeah.
right? So your skincare routine also has to follow all this.
Okay.
Okay. So if you are someone who faces these issues as far as your skin type is concerned, then your skin routine has to change according to the season also. Now, if someone has a normal skin type, so they don't have to worry much. Okay.
Yeah.
Mostly everything suits them, right? So, but if someone has an oily skin type, then you need to choose, light gel based moisturizers, gel based sunscreen, which feel light on the skin, which is not going to clog your pores further. Or so you cannot use very heavy creams
Mhm.
or, Vaseline kind of, heavy
Yeah.
petroleum jelly. These are the things you should avoid.
Okay.
But you can use deep pore cleansers because you have an oily skin, right? Now, if someone has a dry skin, then that person will need to use a heavier
Heavy
cream
wash.
because a gel based cream will they will feel it is dry,
Mm.
right? So, like I said, according to the skin type, according to the season, like probably you may use a very heavy cream during the winter, but you cannot use a heavy cream during the summer. So, all this, once you figure out your skin type, like I told you, then you decide on what you use,
Okay.
right? So, basic your skincare routine always has to have a cleanser, a moisturizer, and a sunscreen. So, cleanser is basically for cleaning. So, when you have an oily skin, you can use a deep pore cleanser or a cleanser with salicylic acid, with a AHA, BHA, because that will help you in balancing the oil, right?
Okay.
When you have a dry skin type, then you have to use like a very mild cleanser, or you use like a cleansing milk which does not lather much. Okay, so that will not dry your skin further. Then we come to hydrating the skin.
Yeah.
Okay, so hydrating the skin is again with the moisturizer. Moisturizer, like I said, an oily skin, you use a gel based moisturizer, dry skin, you use a heavier moisturizer. And then it comes to protecting the skin. Protection is with a sunscreen. Sunscreen is used during the day. Again, if you have an oily skin, you use a gel based sunscreen. If you have a dry skin, you use a creamy based sunscreen. So, this is typically the basic skincare routine that everyone should follow, right? Now, let me give you a word about toner because a lot of people are using toners. Okay, I think toners are overhyped. They don't do much for your skin, frankly.
Yeah.
So you can completely avoid the toner, especially if you have dry skin. Okay, toners are generally alcohol based. So these toners will in fact irritate dry skin further and cause, more dryness. If you are someone with an oily skin, you can still use a toner, though it's not going to, like I said, toner doesn't have much use in your skincare. So you can completely do away with the toner.
So toner can be skipped as well.
Completely.
Okay. And how someone should choose like sunscreen?
Okay. So again, a very important topic. So sunscreen is a lot of people are talking about sunscreens these days. Okay, you have so many sunscreens to choose from and all, right? See now, so coming to the here we take into consideration the skin types, the skin types that I spoke about earlier. Okay, so we have the very fair skin type and we have the very dark skin type. Okay, so the skin type, the fair or the dark, is because of the melanin content in your skin. Melanin is the pigment which gives color to your skin. Okay, so now someone who has a less melanin obviously will have a fairer skin. Someone who has a more melanin will have a darker skin. Now, why is this melanin there? Melanin is a natural sunscreen that your body has. Okay. So, in fact, here I would like to say that biologically speaking, a fair skin is inferior to a dark skin.
Okay.
Right. So, that means you don't have enough melanin. So, your skin is not well protected. Right. So, then that's why in the West, you will see you have a lot of concept of sunblock and very high SPF sunscreens, and they really use sunscreen because they don't have that internal protection that a darker skinned
Skin has.
person will have. So now a fairer skinned person, there is a chance of the person becoming sunburnt. So you become red, you get rashes.
Yeah.
A darker skinned person, like in our country, we tend to get tanned. So again, tanning is a good thing for your skin,
Okay.
right? Because it is protecting you.
Yeah.
Okay. But now what has happened is, why we require a sunscreen, even though tanning is a good thing. Okay. You require a sunscreen because now earlier the sun exposure was not as harsh. Okay. The ozone layer was still intact. Now we have so much of pollution. The UV rays are becoming stronger. Our lifestyle is changing. Okay. So you need to have a sunscreen to protect your skin basically against UV rays, right? Now we also are discovering there are studies which is also talking about the effects of infrared, effects of blue light, your screens and computers, effects of visible light. In fact, even this light has effect on your skin.
Oh.
Okay, so it's no more only UV rays, right? So that is where you get sunscreens which give you filters or which gives you protection against all this. Okay, so when you are choosing a sunscreen, right? So firstly, like I said, you choose the base, whether you want a gel based sunscreen, cream based sunscreen, it depends on how you find it comfortable, right? Secondly, you choose a sunscreen with a broad spectrum. Broad spectrum means it will give you protection against UVA, UVB, and now you have sunscreens with blue light protection, infrared protection, all that. So depends on the kind of work that you're doing. If you are sitting in front of a laptop for a long time, then obviously you require the blue light protection also. So you look for a sunscreen accordingly, right? Uske baad mein, so let's talk about SPF.
Yeah.
So SPF is something which is very, very commonly known amongst everyone. So SPF is the measure of the protection against ultraviolet B. But now we also have other, marking systems which give you protection against the ultraviolet A also. So when you're looking for SPF, also look for things like PA triple plus.
Okay.
Okay. Now, what do? Do you use a very high SPF or a very low SPF? That is another big question that everyone
Yeah.
has. All right. So anywhere between 30 to 50 is enough.
Okay.
Okay. Anything above 50 does not give you any added protection. So
Oh,
studies have found that 50 SPF will give you a 99.9% protection.
okay.
उसके ऊपर it is marginal, मतलब वो 99.9 का 99 होगा.
अच्छा.
So it's not really,
Effective.
doesn't make a huge difference, right? But what happens is when you are using higher SPF, the sunscreen becomes oilier, it becomes more heavier. So you will see that when you are using very high SPF, people don't tend to use it because they find it very uncomfortable, or the skin looks darker, and then they just stop using it because it's, they don't like the feel. So it is better to use a lower SPF sunscreen because it is going to be cosmetically more appealing than not use a sunscreen at all, right?
Okay.
So anywhere between 30 and 50 is more than enough. What is more important is how much to apply, when to apply.
Yeah.
Okay. So you have to apply, we typically say about 2 fingers of
Okay.
cream you take or the sunscreen you take for the face and the neck. Okay. So 2 fingers typically is a lot. No one applies that much,
Yeah.
frankly, but that is the ideal that you have to use. उसके बाद में you have to use the sunscreen every 3 to 4 hours
Okay.
because the sunscreen effect is gone after 4 hours, right? So that is also actually not very practical. We generally don't do it. Even I don't do it. But what you should do is at least ideally apply it once in the morning before you step out for your work, 20
Okay.
minutes before you step out. उसके बाद में if you're going to be out in the sun for a long time, then I suggest you please reapply it. If you're going to be in the office, then once in the afternoon is a, kind of a doable thing.
Okay.
But yes, sunscreen is extremely important. If you are not going to follow any skincare routine, then just use a sunscreen. Okay.
Okay.
So it'll prevent tanning, it'll prevent sunburns, it will prevent, sun allergies. It can prevent premature aging of the skin. So sunscreen is a must, whether, and it is to be used all year round.
सनस्क्रीन नाइट में भी लगाया जाता है या लाइक या
See,
फिर सिर्फ डे
what
लाइट?
it is as the name suggests, it's a sunscreen,
राइट.
right? So only when there is going to be sun, when there is going to be light, you apply the sunscreen.
ओके.
Abhi typically if someone is working at night in front of the laptop, then probably that person might need to apply the sunscreen.
ओके.
But otherwise, for a normal person, from
हुँ.
whenever there is light, like let's say from 8 o'clock to about 6 o'clock, okay, that is the time when the sun rays are there, you apply the sunscreen. There is no need for you to apply it at night.
ओके. Are natural ingredients are like better for skin or the drugstore or medical grade?
All right. So, see, I will tell you this that a lot of the skincare ingredients have come from the kitchen.
Okay.
Okay. So, like if you have let's say a lactic acid, okay, lactic acid is a part of a lot of skincare
Yeah.
formulations. Lactic acid is nothing but milk, it's the acid in milk. Then there is something called as malic acid. Malic acid is nothing but apple acid in the apple, right?
Okay.
So a lot of these ingredients have come from the kitchen, right? But it's not that every time everything natural is good, and it's not that everything chemical is bad. All right. So now, see, earlier, our grandmothers and our mothers have used a lot of these kitchen remedies, like they've used multani mitti
Yeah.
or some curd or milk or something which was used, which was fine for them. Okay.
Okay.
But now what has happened is, firstly, though, you don't get such pure ingredients now,
Yes.
firstly. Secondly, the kind of exposure, sun exposure, pollution exposure, the kind of lifestyle we have, the kind of food we eat, the kind of stress we have. Okay. And, so somewhere or the other, our skin is damaged internally also and externally also.
Okay.
Our mothers or our grandmothers did not go out in the sun so much, right? So all these things, they're skin barrier. So there is something called as a skin barrier, all right? So your skin is made up of different layers, right?
Mm.
The outermost layer is called as the epidermis, okay? And the epidermis ka outermost layer is a dead cell layer, राइट?
Yes.
ये डेड सेल लेयर जो होता है ना, इट इज एक्चुअली लाइक, आपने अगर कोई वॉल कंस्ट्रक्शन होते हुए देखी
Mm.
होगी, तो ब्रिक्स होते हैं और बीच में सीमेंट होता है, मोटर उसको बोलते हैं.
Mm.
सो इट इज एक्चुअली इन दैट फैशन. इट इज कॉल्ड एज अ ब्रिक मोटर लेयर. Okay, so now this layer is extremely important because it keeps the bacteria, virus, fungi, it out. Okay, so your skin make is like your first line of defense.
Okay.
It keeps out the sun rays, it keeps out the pollution. Even if you like put a drop on your skin, you put a drop of water on your skin, the water does not get absorbed, right?
Yeah.
So your skin is waterproof, right? The water just slides off. So that is another very important thing, because if you have an intact barrier, then your skin is waterproof, it is weatherproof, all that is there, right? Now what has happened is our skin barriers are not as good as they were earlier.
Okay.
Lots of reasons, like I said, stress, your exposure to sun, pollution. A lot of people are now applying a lot of things to their skin,
Yes.
right? So many people are like, just watching something or picking up creams over the counter. Like, there is so much of this EHA, BHA fad, this, that, and everyone is applying something or the other without even realizing that, if they are supposed to apply it, not supposed to apply it, if they're applying it rightly, not applying it properly. Okay. So because of this, the skin barrier is any which way is damaged.
Okay.
And then what happens is, then if you're not using a sunscreen, or other chemicals, we do so many of chemical treatments from the salon and all, so all this affects, right? So what is the difference between applying a milk at home, that is, like I said, it's the same lactic acid, and applying a lactic acid in a bottle, all right? So here there is no standardization, right? तो आपका milk, उसका concentration कम ज़्यादा होता होगा. Probably the milk is a day old, 5 days old. There is no standardization how much of a concentration is there. When it is extracted and formed as a medicine or a cosmeceutical, there is very stringent. It is all formulated, with, it is, there is written, it is a 10%, it is a 5%, it is a 2%, right? So that is why it is always better that you use a medical grade skincare. Now, what happens also is, now suppose, you have heard people use lemon on the skin.
Lemon and sugar.
Yeah. Now, what, lemon is pure citric acid. It is acid in the name. So when you're applying it, it is going to cause irritation to your skin. You don't know how much you're applying, right? थोड़ा ज़्यादा लगा दिया, कम लगा दिया, एंड फिर आप वो लगा के आप बाहर जा रहे हो धूप में, सनबर्न बैठेगा.
Oh.
So that is why it is always better that first, don't experiment too much with your home things. Okay, if you're applying milk or you're applying malai, that is okay, because that is for hydration.
Mm.
But instead of, like people are applying this citric acid, toothpaste people are
Yeah.
applying for pimples.
Tomato as well.
So all this is, it can be extremely harmful,
Okay.
right? So do not try. So there are so many, on Instagram now, you see so many things, people are doing some weird things.
Yes.
So don't, because you don't know your skin type, you don't know
Right.
how you will react, firstly. Secondly, when you pick up a product over the counter, always remember that over the counter जब ये products sell होते हैं, so they have very little actives. So a lot of times ना, it's not going to help. It will just act like a moisturizer. Now when you go to a doctor, so medical grade skincare, you have to get it prescribed from a doctor.
Right.
Ideally, you cannot just use it. Okay, ideally, but people do. So when you take medical grade skincare, why is it available as a prescription? Khair, India mein everything is available. You don't require a prescription. That is the, because we don't have the, rules and regulations. But typically, like, a retinol preparation or a AHA, BHA preparation, which are available as prescription medicines, because the actives in this is very high.
Okay.
Okay, so there is a particular way that it has to be applied, a particular skin type. We examine the skin and decide, okay, do you need AHA, or can you handle a retinol? Okay,
Okay.
so these medical grade skincare is always going to be better in terms of efficacy, because the active concentration is more. But if you don't apply it, use it under the supervision of a doctor, then you might land up in trouble.
Okay.
You might land up with side effects.
What are main triggers of hyperpigmentation and how can be it managed?
Okay. So whenever you see anything dark, okay, dark skin, for a layperson, it is all hyperpigmentation. It may not be hyperpigmentation. All right. So there are lots of reasons. So true hyperpigmentation is, like I said, the melanin pigment increases in the skin. Now, when does this happen? Typically, when you spend too much of time outside in the sun. So tanning is again, because when we spoke that melanin is a natural sunscreen.
Yeah.
So if you're going to spend too much time out in the sun, your body is obviously want to protect its deeper layers against the sun rays, so it will increase melanin. Okay, so that is one thing, right? Secondly, there is another very common condition called as melasma, वांग या छाई जिसको बोलते हैं हिंदी में.
Okay.
So you get this pigmentation typically on the cheeks, forehead,
Mm.
center part of the face. So that is again hyperpigmentation. It is seen very commonly in females, less commonly in males, more commonly in females. It has some hormonal basis, okay, because it is seen more commonly during pregnancy or after delivery, menopause, or if you're taking oral contraceptive pills. Okay, it increases because of sun exposure again. So that is again another, kind of hyperpigmentation. Then there is something called as PIH. PIH is post-inflammatory hyperpigmentation. It happens when some damage to the skin has occurred. So you will see a lot of times after skin conditions like eczema or psoriasis, that once the patch is healed, the skin there becomes dark. So
Okay.
that is post-inflammatory. So after some inflammation, the hyperpigmentation which remains is called as post-inflammatory hyperpigmentation,
Okay.
right? Then sometimes pigmentation can occur because of certain medicines. Sometimes it can happen because of certain metals, right? Certain, even your makeup products
Okay.
can sometimes have certain metals or certain ingredients which can cause hyperpigmentation. Okay, so it is very common also, for people who apply a lot of makeup, you see that they have developed pigmentation, right?
Yeah.
So lot of reasons for pigmentation. The commonest would be, I would say, if you the sun exposure, all right, and if you have a damaged skin barrier, so your skin is going to repair itself with some amount of pigmentation. All right. So these two things are very common. Now you also have sometimes now you have these you have what should I say, something called as acanthosis nigricans. Okay, which is seen as pigmentation typically at the nape of the neck or
Okay.
underarms or around the eyes or forehead. Now, this again, a lot of people mistake it for pigmentation because it looks dark, but it
Yeah.
is actually not pigmentation.
Oh.
It is when someone is overweight,
Okay.
all right, your body is not able to function properly. When you are, especially you're very obese or someone has diabetes, okay, so your body needs to produce more insulin to do the work because it's not done efficiently. So when this more insulin is produced, that insulin goes to the skin because that excess insulin is there, and it causes thickening of the skin. So it is
Okay.
actually thickened skin which appears darker, and that is why people think it is hyperpigmentation. So a lot of times you need to find out the cause of hyperpigmentation, and then you can treat it,
Okay.
right? But commonly what everyone should follow is avoid excessive sun exposure, use a sunscreen regularly, like I said, make sure your skin barrier is intact, Make sure that you are not using a lot of products and, kind of changing your products continuously, or because that can also, you never know, some product might suit you, some product might not, and
Right.
can give you pigmentation. Nowadays, also hair dyes can also give you pigmentation because you
Oh,
can be allergic to some a part of the hair dye.
right.
So these are in general the common causes. So like I said, it is always better to visit a dermatologist so that you can find out what is the cause of your condition and accordingly take treatment.
What is psoriasis and how someone can manage it or it can be treated?
So psoriasis is a common skin condition that we come across. Psoriasis is basically, it has a genetic predisposition. So
Okay.
it sometimes runs in families. It has, the condition has something to do with the immune system of the body. Okay, so there is some immune dysfunction which happens, because of which what happens is, see, your skin, you are aware that we shed our skin every 28 days. The topmost dead layer is shed every 28 days. So अपने स्किन में, like I said, there are layers.
Right.
ऊपर का लेयर होता है डेड लेयर, नीचे के लेयर्स आर ऑल लिविंग लेयर्स. सो इसका साइकिल चालू रहता है. तो ये नीचे से ये लेयर ऊपर 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 जाता है. जब तक ऊपर जाता है तब तक वो डेड हो जाता है, एंड देन दैट लेयर इज शेड, and then this cycle continues. So this shedding happens every 28 days. Now in psoriasis what happens is, ये जो cycle है that becomes very rapid, and sometimes it can be as low as 4 to 5 days as against 21 days. So ये सेल टर्नओवर जो होता है नीचे से ऊपर जाना, ये बहुत फास्ट हो जाता है. उसके वजह से आप देखोगे उसमें ऐसे स्केल्स आते हैं, ऊपर ऐसे स्किन
Yeah.
निकलती है, राइट? So basically it's some kind of a immune dysfunction which happens in the body, which gives rise to inflammation, which gives rise to scaling. So your skin is being shed. Okay, so you get these red patches. Okay, typically at on the elbows, knees, sometimes in the scalp, back. So red patches है और उसके ऊपर ऐसा silvery scale स्किन जैसा निकलते रहता है. So
Okay.
that is what is psoriasis. Okay, मैंने आपको बताया
Hmm.
क्यों होता है. So genetic predisposition होता है, so it can be hereditary. Secondly, a lot of causes, a lot of other triggers can be there. So certain medicines can increase your psoriasis, like antihypertensives, some antibiotics. उसके बाद में there is something called as a metabolic syndrome. Okay,
Okay.
so metabolic syndrome is basically इतने दिन तक, now with research we have found that people who are obese, okay, or people who have sugar, diabetes, or hypertension are more prone to get psoriasis, and vice versa also. Okay, so if you have psoriasis, there are chances that if you don't manage your weight and all, then there are chances that you can develop early diabetes also. So all this, now we have found that there is a lot of link between the underlying disease and with psoriasis. Stress is definitely a very big factor.
Okay.
Stress definitely exacerbates psoriasis. Your habits like smoking, drinking, that also exacerbates psoriasis, right?
Okay.
So basically, what, like I said, psoriasis mein the dead skin layer is being shed continuously. So whenever your skin feels dry, or you are using some harsh soap or detergents, or that can give rise to make the skin more drier, and that can exacerbate the symptoms of psoriasis. So for a psoriasis patient, what is important is that you keep your skin well moisturized. Take a short shower, not a very long bath, and that too with lukewarm water. As soon as you finish your bath, just tap your skin dry, don't rub it. Okay, and apply your moisturizer on damp skin, so you lock the moisture in.
Okay.
Do this twice a day. All right, उसके बाद में avoid harsh soap, avoid harsh detergents. It has a seasonal variation, so be careful, because in winters generally psoriasis will exacerbate as compared to summers. All right, adopt healthy habits, exercise, adopt a healthy diet, okay, and stress management techniques, because stress definitely increases psoriasis. If you have bad habits like smoking, drinking, you need to cut down on that, and always visit a qualified dermatologist for the treatment. Because nowadays, you will see there are so many ads on TV, like some doctor is claiming to cure psoriasis, some with some ayurvedic thing, some home remedies and all. So a lot of times what happens is now when you visit these doctors, you end up making it more worse.
Okay.
Okay. So always visit a qualified dermatologist. See, people get scared because ads are everywhere. There are ads which say that psoriasis does not get well, and they show such bad photos of patients and
Yeah.
all. So, one thing I want to clarify that yes, psoriasis is not curable. What I mean by not curable is अगर आपको फ्लेयर आया है, आपको पैचेस है, तो वो ट्रीटमेंट से वो सब बैठ जाएगा, क्लियर हो जाएगा, राइट? बट वो वापस नहीं आएगा, इसकी कोई गारंटी नहीं है.
Okay.
दैट इज व्हाई वी से दैट इट कैन बी कंट्रोल्ड, बट इट इज नॉट क्योरेबल बिकॉज वो जड़ से नहीं जाता.
Okay.
But like I said, it can be kept well under control with the proper treatment. So always visit a dermatologist.
Medifacials are talk of the town. So how these are different from the facials?
See, typically, I'll tell you what happens is, what are facials, okay? So facials, you go to a salon for relaxation,
Yeah.
basically, right? Now, when you go to a salon, when they are doing a facial, they will do things like bleach. They will give you steam. They will try to remove your blackheads, your whiteheads, and then apply some mask, some massage, all that, right? Typically, if you see, yeah, I don't know if you've ever had a facial. Do you does it last, the glow last for many days, or typically what I have seen is एक दो दिन तक वो रहता है और फिर
Maximum is a week.
हाँ चला जाता है. बहुत बार इनफैक्ट वो ब्लीच वगैरह लगाने से इनफैक्ट रिएक्शन हो सकती है,
Yes.
all that. They're not supposed to kind of fiddle with your acne and all. So now, because people are also want this relaxation and all, so now we have something called as medifacials. Medifacials is a relaxing treatment which you come on a monthly basis, or and just kind of pamper your skin. But then in a medifacial, you're doing it in a much more scientific way.
Okay.
So you will see that in a medifacial at any dermatologist's office, there is no use of any bleach, there is no use of any steam,
Yeah.
there is no kind of some blackhead removal or something, until unless it is done by the dermatologist properly. No popping of pimples, stuff like that is not done.
Yeah.
So in a medifacial, what we do is we analyze your skin type. Okay, we see what skin concerns you have, and then accordingly we will suggest, like now if someone has a acne prone skin, then we will have a medifacial with the use of salicylic acid. Okay, or if someone has very dry skin, then we will do something like a hydrofacial. Or someone has pigmentation, okay, so we will do something with a glycolic peel or a lactic peel. So basically all the ingredients which are used are scientifically proven to
Okay.
help your skin, and with that we give you that pampering feeling of a massage and a mask. So like I said, it is a very scientifically designed treatment wherein we are using a scientifically proven technology and combining pampering and relaxation. So in the long run, it is going to help your skin rather than damage it.
So if someone have a sensitive skin, how one can take care of it?
Okay. So see, sensitive skin is not a term in dermatology.
Okay.
Okay, ऐसा कोई term ही नहीं है.
अच्छा.
Okay. But yes, people come nowadays, a lot of people come and say that मेरी skin बहुत sensitive है and all. So let us understand what it is. So sensitive skin, basically what I look at it as, or any dermatologist will look at it as, that your skin generally breaks into rashes. Some products will not suit you, or it is suddenly dry. Sometimes it is suddenly oily. Something like that, because your skin is very unpredictable,
Yeah.
right? That is what generally patients mean, or what we mean as sensitive skin.
Okay.
Now, understand one thing, that sensitive skin is not a skin type.
Okay.
It is not. Okay. A lot of times, someone will have sensitive skin because of the patient's own doing.
Okay.
You're not born with sensitive skin, or there is some underlying disorder. So, a lot of times nowadays, what like we spoke that, people are using so many क्रीम्स एंड ओवर द काउंटर दिस और ये इन्फ्लुएंसर का देख के ये वो डीआईवाई वो सब ये सब आप जब लगा रहे हो तो आप ये नहीं सोच रहे हो कि आपके स्किन पे उसका क्या इफेक्ट हो रहा है योर बैरियर इज गेटिंग डैमेज्ड ओके यू आर यूजिंग रेटिनॉल यू आर यूजिंग एएचए आज रेटिनॉल लगा लिया कल एएचए लगा लिया परसों विटामिन सी लगा लिया उसका आपस में भी क्या इफेक्ट होता है लाइक यू से दैट those two things can they be applied together not applied
Okay.
together उसका इफेक्ट होगा your barrier is getting damaged फिर वो आप लगा के बाहर धूप में जा रहे हो so all this is also happening right so that is why your skin has become sensitive because your barrier is damaged
Right.
so you're not born with a sensitive skin
Oh.
right so you a lot of times you have damaged your skin and made it more sensitive right sometimes you apply certain things which are not suiting you okay you can have like a contact allergy to something some metals some creams that can also make the skin sensitive people who have dry skin or a aging skin is typically beyond 50 especially in women after
Okay.
menopause because the skin becomes extremely dry right dry skin can be called as a sensitive skin because in the dry skin again the barrier is damaged so
Okay.
every time the barrier is damaged your skin will not be able to function properly it will react more to uv exposure it will react more to pollution or it will normally a skin with an intact barrier may not react to a product but in a skin which has a defective skin barrier may react to the product also
Okay.
okay sometimes you go to apply something kitchen mein se if your skin barrier is not intact or you have dry skin you might react to that and then you might feel that I have sensitive skin right another very important subset of these people is some when they have something called as rosacea so rosacea is more common than people know a lot of times people with rosacea think that they have acne because
Okay.
it presents in a very similar way. So rosacea is basically seen more commonly in fair-skinned individuals, though it is seen in darker-skinned people also. So इसमें होता क्या है your blood vessels जो रहते हैं skin के they are more sensitive okay to certain triggers. तो वो triggers क्या क्या हो सकते हैं it can be excessive sun exposure it can be eating spicy food it can be drinking alcohol सो ये ब्लड वेसल्स जो ट्रिगर होती है सो दे डायलेट वो डायलेट होने की वजह से क्या होता है ब्लड सप्लाई बढ़ता है सो इन दीज पीपल जनरली ना दे विल लुक रेड when they go out in the sun or then when they eat something spicy or something hot or drink alcohol they look flushed ये फर्स्ट स्टेज हुआ उसके बाद का स्टेज आता है कि एक्ने जैसे मार्क्स आ जाते हैं
Okay.
पिंपल जैसे उसके बाद में ये जो ब्लड वेसल्स जो सिर्फ डायलेट होती है ऑन ट्रिगर्स then after that they stay dilated even without the triggers and then the skin becomes thicker so this is so people with rosacea typically we can say that they have sensitive skin because their skin can be dry 1 minute it can be oily 1 minute because their skin is their blood vessels and all is so sensitive even their barrier is a lot of times damaged okay so these people with rosacea they again have sensitive skin
Okay.
so basically you need to find out that sensitive skin क्यों है आपका are you doing anything wrong are you
Okay.
applying something which you're not supposed to apply do you have rosacea do you have dry skin are you having even people with thyroid have very dry skin people with
Okay.
menopause after menopause women are having dry skin so you need to first find out why that sensitive skin is happening and then you have to make accordingly then you have to manage it right
Okay.
so using too much of products doing all those following those instagram
Hacks.
hacks like there's something called as double cleansing
Yes.
which is being done Now, double cleansing you do if you have an oily skin or if you're using too much of makeup
Okay.
and then you do it, it is okay. Because in double cleansing, you first cleanse with oil, then you cleanse with a normal face wash. Now, if imagine you have dry skin, your skin is already having less of oil,
Right.
लेस मॉइस्चराइजर एंड ऑन टॉप ऑफ दैट जो थोड़ा बहुत ऑयल जो आपके स्किन पे है वो भी आप 2 बार क्लीन करके साबुन से पूरा स्ट्रिप कर देते हो and you're doing it on a daily basis. So your skin is obviously going to become sensitive because your barrier is damaged. So you need to find out क्या है sensitive skin, actual है नहीं है, आपके habits उसको promote कर रहे हैं नहीं कर रहे. So the best person to diagnose if you have sensitive skin is your doctor. One tip also what I would like to tell is don't use too many products. Don't change your products often. If a certain product has suited you, stick to that product. If you keep on changing your product, फिर हो सकता है कि that product may not suit you and then you might feel that I have sensitive skin,
Right.
right? Always when you use a new product, always do a patch test. Okay. What do I mean by a patch test is whether it is hair dye, whether it is any product, new product, always apply it behind the ear.
Okay.
Okay. So which is not visible, or
Yeah.
you can, apply it on the inner corner of your elbow.
Okay.
Leave it there for at least 24 hours. Uske baad mein, if your skin is not reacting, if it has not become red or anything, then probably that product is suiting you.
Okay.
Again, a word of caution here. Sometimes you can have late reaction as late as 48 to 72 hours.
Oh,
But at least, this is one thing that you can try.
what is vitiligo?
So, see, vitiligo is commonly it is also called as leukoderma.
Okay.
Okay. So, vitiligo is when the melanin is less,
Okay.
right? So, and that it is less at certain areas. So, you may get vitiligo patches, like you may get white patches at places. Okay. Vitiligo is, you must have seen it is generally considered a taboo in the society.
Yeah.
People don't accept them easily, though now things are changing definitely. But earlier, yes, and people in general feel very self conscious also. I get a lot of patients, who come and ask me about before marriage proposals that if girl or the boy or someone in the family has vitiligo, then should they marry or they should not, or what? How will the child be affected? So, see, one thing that I want to make very clear is vitiligo is a cosmetic problem, just like hyperpigmentation. आपको टैनिंग हुआ है
Mm.
या मेलाज्मा हुआ है, it is a cosmetic problem. यहाँ पे pigment कम हुआ है.
Okay.
Okay, so it is the exact opposite. That is a hyperpigmentation. This is a depigmentation. So इसमें it is just a cosmetic problem. अंदर से there is no medical illness, there is no problem, there is no issue. You can live an absolutely healthy life. You can lead a healthy life. There is no, you don't have any medical issues or anything. So I think we should be more accepting of these people because it is just a cosmetic problem, firstly. Secondly, you want to get married, there is no problem at all. There is not more than 2 to 5% chance that your child, like, a child of the marriage product, may have vitiligo.
Okay.
The chances are very, very slim. So I think we should not discriminate based on, the color or so it is basically a kind of discrimination.
So, ma'am, my last question to you is some summer tips and some products which we can use for the summer.
So see, summers in India typically quite hot. Okay, now the temperature is like just soaring. Plus, it is humid and you tend to sweat, right? So, very simple things you should follow, right? So, make sure that you take a shower every day. Okay, take a lukewarm water, your cold water shower. Again, limit your shower time first. Secondly, if don't let the sweat accumulate too much. Okay. Thirdly, don't wear loose cotton clothes. Don't wear tight clothes. Okay? Because again, there is no ventilation, there is no air passing, there is, so all this will give rise to fungal infections. The season is very common for fungal infections, right? No sharing of clothes. Don't share items of personal use like towels and stuff. Use of a sunscreen, very, very important. All right. So sunscreen is a must. You know, whether, and in fact, I say whether you're outdoors or indoors, right? Hydrate yourself.
Okay.
Very important, because again, it's so hot, so hydration plays a huge role. Summer may also you require a moisturizer. So don't skip your moisturizer, because like we said that a moisturizer is required to maintain your skin barrier. Right. So your skin also needs to be hydrated. So there are two different things. A lot of people come and tell me that they're drinking enough water, but their skin feels dry. So it does not mean that because you're drinking water, your skin will not feel dry. It is both the things. It is hydration from within and it is hydration from outside also.
Okay.
Right? When you're drinking enough water, it is in general better for your system because it helps to flush out toxins and everything.
Yeah.
That does not mean that that water is going to reach your skin and hydrate it. बाहर से जो आपका बाहर का लेयर है, उसपे जो ड्राइनेस होता है, इसके ऊपर धूप गिर रही है, इसके ऊपर पॉल्यूशन गिर रहा है, सब। तो यहाँ बाहर से तो आपको हाइड्रेट करना ही पड़ेगा ना, एज़ द वे यू आर हाइड्रेटिंग फ्रॉम इनसाइड, you have need to hydrate it from outside also, right? So hydration again forms a very important thing. Your diet, okay? Having more of liquids, having more of fresh fruits, vegetables, all this also contributes. Avoid the sun, as in, avoid the strong sun from 12 to 4.
Okay.
And in spite of using a sunscreen, always, if possible, if you're going to be out in the sun for long, then, carry an umbrella
Okay.
or wear like a hat or a scarf. Because what happens is that the sunscreen, and especially when you're sweating, we say the sunscreen remains for about 3 to 4 hours. But when you're sweating, it can, the effect may go away in an hour's time also,
Okay.
right? So that is also very important. So you do a sunscreen protection and plus physical protection with your clothes or your umbrella. All that is also very important.
Right. This is a basic
Right.
routine, if you can suggest.
So basic
Yeah.
routine, like I said, see, your
Sunscreen.
very simple routine, not too much. Let's not make it very complicated. You require a cleanser, moisturizer, sunscreen.
Okay.
All right. Typically, if you have a normal skin or an oily skin during the day, you can use your cleanser and your sunscreen directly, because with the moisturizer and the sunscreen, it may feel too heavy. At night, you use your moisturizer. Okay.
Okay.
That is, this is a very, very basic skincare routine that you can follow on a daily basis. If you have dry skin, I always say that in the morning, you can avoid the cleanser and just use the cleanser at night, after the day's dirt and everything you want to clean,
Okay.
right? If you have aging skin, after the age of 25, 30, ideally you can add some serum, corrective serum, some eye cream, okay? Because then the first signs of aging start, okay? Your collagen starts breakdown. So it is better to prevent.
Yeah.
Then when you start taking care right now, like in your 25, 30s, obviously, it is better for your 40s and 50s. Even the treatments will work better later on, right? So if you want to, you can start with a very basic serum or a night cream, again under the supervision of a doctor, okay? Because a lot of times, like I said, people just go over the counter, apply retinol, AHA, BHA, and then see, retinol or AHA, BHA, these are acids, okay? These can strip the skin of its moisture if you're not
Right.
applying it properly. So maybe you have dry skin, so you can't apply retinol, so you don't know
Okay.
what skin type also you have,
Right.
right? A lot of times what happens is people are applying AHA, BHA and retinol or vitamin C, and this, two don't go together, okay? Now vitamin C needs to be applied during the day.
Okay.
It gives you better protection. With retinol needs to be applied at night. A
Okay.
lot of people are not aware of this,
Right.
right? So all this is very important. That is why it is always, I think it is better that whenever you feel, you want to start like a proper skincare regime to prevent aging or prevent some skin concern or something, always visit a doctor and get like a proper skincare routine from the doctor. But otherwise, your basic cleanser, moisturizer, and sunscreen is good to go.
Thank you, Mom. It was really lovely to have a convo with you today. And I really got to know so many things about my skin as well. And I hope everyone got to know about their skin.
Thank you. Thank you so much.